What's going on, everybody? My name is Dr. Nathan Thompson with Exemplify Health Center, your Wellness Way affiliate in Yorkville, Illinois. Happy Monday evening, guys. Hope you guys had a great day. I'm finishing up my day at the office. Lots of visits, lots of consults, lots of blood draws. It was a great day. I always appreciate you guys when you jump on live with me. In fact, if you guys watched yesterday's live, I just did a live off the cuff. I was at the office finishing up a talk for a seminar that's coming up with the Wellness Way. And I wanted to go over some blood work with someone after 14 weeks post JAB. And the videos guy absolutely exploded. I didn't expect it to. It's over, I think, 100,000 views just on Facebook alone. And I always appreciate, guys, the great comments. I always appreciate the not so great comments. There was some interesting comments, about me drinking water, how rude it was. Guys, I want you to know something. If I drink water or I'm licking my lips or something like that, I'm actually wearing corrective braces right now. You can't really see them, but they do make my mouth. I have to wear them all the time, probably for the next 4 or 5 months. Which makes me speak a little bit different. Also makes my lips really, my teeth really dry. So I apologize, just so you know, if you had some disparaging comments regarding that. I also had an interesting Bruce Willis comment. Guys, keep them coming. They give me a laugh sometimes, good, bad, or indifferent. So guys, I appreciate the follows. I appreciate the shares. I always appreciate the support. I was actually going to do this yesterday, but I wanted to do the other video and just hold this one off until today. So thank you guys for the questions that you submitted. I went through all of them. I obviously couldn't pick all of them, be able to answer all of them. However, I picked about, I think, 6 or 7 questions that I think will be able to pertain to as many people as possible. I know that some people submitted some very, very specific questions regarding labs and medical advice and things like that. And guys, just understand is we can't really give very specific technical advice and medical advice or healthcare advice without actually being a patient or actually being able to see your labs and things like that. So I will tell you in just a second, because we, again, have probably had, 100 messages just from yesterday within the last, 12, 13 hours about where can I find a doctor? Are you taking patients right now? Do you work remotely? Things like that. I'll answer that question because someone asked a great question regarding that. So guys, if you're watching this right now, please say hello. Please share this video as well. We're going to go over a lot of different topics. I'm going to try to give you as brief and concise answer as possible. I do realize that sometimes I can tend to be long-winded. My wife tells me that, and I agree with her as well. So let's go over some questions, and I'm going to give you my best answer. I actually just pulled these. I haven't really thought about much about the answer, but I'm obviously going to do my best. All right, so first question. Before we do that, though, guys, if you are from the Yorkville area, tomorrow night we have reopened up our in-person inflammation talk. So if you are from the Yorkville or the Chicagoland area, guys, we don't stream this live. This is not something that you can access live. This is an in-person event only. But the reason why this is so popular, guys, is inflammation is the spark that leads to literally every single disease, degenerative disease out there. So when you're talking about weight loss, resistance, cancer, infertility, thyroid disease, arthritis, type 2 diabetes, autoimmune issues, hormone imbalances, things like that, guys, inflammation is the first thing to tackle, and it's also the first thing that actually gets people to start to feel better. I want you to remember this. The more inflamed you are, the less energy you're going to have. Okay, think about if you had COVID, for example. When you had it and you had body aches, you had body pains, and people thought, "Oh my gosh, look at these weird symptoms coming with COVID." No, these are symptoms of a long-term inflammatory response. And so you're going to see when you have a high amount of inflammation, you don't have much energy, you want to sleep, you want to rest, you want to conserve energy. And so a lot of you are walking around and you want your energy to be back, but what you don't realize is it's not adrenal fatigue. What it is inflammation and then adrenal downregulation. So you guys, if you can discover what the 3 biggest areas of inflammation are and be able to know how to test them properly through lab testing, through x-ray, other things as well, you can get your life back. But the first things you have to handle is you have to handle inflammation first, because it's like trying to heal a scab when you keep hurting it, okay? It's never ever gonna heal if you're constantly staying in a state of inflammation. So guys, make sure you go to the top of this page. You can find the Eventbrite link, get registered for it. No, it's not a webinar, this is an in-person event, so please don't register for it if you are from Canada or if you're from a different part of the country. This is for Chicagoland area only, unless you wanna fly in really quick or drive in really quick. We'd love to have you as well, all right? So let's go over the first question. Thank you, Lisa Martin, for submitting this. She says this: how can someone who has had a gallstone avoid getting their gallbladder removed? Okay, this is very common, especially with ladies. Female, 40, fertile, typically they're overweight, and they're overweight because of what's happening with their liver. How can you avoid them getting their gallbladder removed? Everyone's telling my daughter different things, and she's confused what she should eat or not eat to avoid having another gallbladder episode. She has a 5mm gallstone blocking her common bile duct, and it was removed on Monday. Surgeon wanted to remove the gallbladder, and I said no. He came in her hospital room every day pressuring her and telling her it will be worse next time, and informed him we are exploring other options for now. Lisa, thank you for exploring other options, because I think that yes, there are times when someone needs to get a gallbladder removed because there's so many stones in there. But I want to tell you something. I appreciate that you actually want to save a gallbladder, because I see a lot of women who come in who have had their gallbladder removed, and the doctor, usually male, has no problems removing that. They just think that the gallbladder is some kind of like nuisance organ that you really don't need it. The reality is the gallbladder is a very, very important organ because it is storing bile that is produced by the liver. So liver produces the bile, and then the bile is then transported into the gallbladder, where it's then stored. And the reason for bile is to help break down, help to emulsify fats, and it also is going to have a lot of nasty stuff in there, which mostly is going to be detoxification products, because your liver is doing that all the time. And where most of it is actually ending up is within the gallbladder and within the bile. So bile is going to have your hormones that you have actually processed, which is why it is so important to actually have your gallbladder, because it makes it a lot harder in order for you to be able to detoxify if you don't have your gallbladder. So the question is number one, try to keep it as much as possible. But I will tell you this: if your daughter, and you actually look fairly young, so I'd like to know how old your daughter was. If your daughter is already having problems with gallstones, then she has a problem with the liver, and I'm going to assume there's other issues that are going on as well. Because guys, there are pathways that help to create, enzyme pathways that help to create bile, and a lot of those same enzyme pathways are involved with the removal of the processing of hormones, the removal of hormones. You have all these CYP enzymes that are taking place in through the liver. So it's never just a gallbladder. There are other issues that are involved with the liver, which I can guarantee you she probably has a big time issue in regards to estrogen metabolism. Now, there are things that you can do in order to help the liver, in order to heal the liver. But I think your question is what do I do right now if there's another stone? What can I do? Long-term solution is to fix the liver. Short-term solution is if there are some active stones, there are some great resources that you can do that will help actually break up and soften the stones. There are certain things that you can do in order to help, once they are broken up, help squeeze the gallbladder in order to be able to remove some of the stones. We've had people do this before. We've had people pass multiple stones by doing this. But ultimately, though, after that happens, you need to fix what's happening in through the liver. There's a couple of good resources that you can use. And yes, there are certain things that help the gallbladder to contract. Turmeric helps to do that. Milk thistle can do that as well. But there's a great resource if you go to Hulda Clark. There is a great website, Hulda Clark, and there's a whole protocol that you can do that will help to first prepare the gallbladder by softening and breaking down the stones, and then doing things to help with gallbladder contraction in order to be able to pass those stones. And yes, I've seen it before. I've literally seen 40 or 50 stones within a person's stool. So the biggest thing is work on, if that's what you need to do that right now, and then work on actually fixing and healing the liver, because I guarantee you there's going to be some other problems that are going on, especially when it comes to estrogen metabolism. But thank you very much for that question. Annie, who I have seen many times comment on our page, thank you very much Annie, for asking this question. Does having thyroid antibodies automatically mean one has Hashimoto's? Okay. What kind of exercise, if any, should someone with hypothyroidism with Hashimoto's and possible adrenal fatigue be doing? Okay. Let me answer the first question. So having thyroid antibodies, yes, it automatically does mean that you do in fact have Hashimoto's. So Hashimoto's is basically an autoimmune condition in which the thyroid is inflamed and that the immune system is breaking down the tissue within the thyroid gland. It's not attacking itself, but there's some kind of infection that is going on within the thyroid gland. It can be a virus like Epstein-Barr virus. It can be wheat gluten because it's very biologically similar to thyroid tissue. It can also be yeast. Now, there's so much blood supply that's going through the thyroid because you have a lot of your blood supply going through the thyroid that's going directly to the brain because there's a big time feedback loop going from the thyroid to the brain to your pituitary gland that is letting the brain know, hey, we need to be releasing more thyroid stimulating hormones. So it's important for those two different glands, the pituitary gland, and then also for the hypothalamus to the pituitary to the thyroid gland. It's very important for them to stay in constant communication. Now, if you do have thyroid antibodies, yes, it is Hashimoto's thyroiditis is what they call it, but there's different levels of antibodies that you can have. Anytime there's antibodies, it means that the thyroid is getting destroyed. However, let's say your TPO count is at 50, it means that it's happening pretty slowly. We actually just measured someone who was at 5,500, the largest that I've ever seen. Actually, when I tested my wife for the first time, she was at about 2,400. I've tested it in the 3,000s, I've tested it in the 4,000s, yet they still had a functioning thyroid, which means that they didn't have enough thyroid destruction at that point to cause hypothyroidism. Now, this is actually the main reason why someone does have a thyroid or hypothyroid. The number one reason is because of Hashimoto's, which means that the longer this happens, the longer that the doctor refuses to test for it properly, it just means that you're not doing the things in order to slow down or stop the destruction of the thyroid. So, if you have an antibody count, in fact, we just did redid an antibody count in someone with Hashimoto's who still had a functioning thyroid, and her antibodies went from 4,400 down to 1,800 in a matter of about 4 months. That means that we have removed the triggers that is causing the thyroid destruction, and that destruction is happening at a slower pace. Guys, this is no different than type 1 diabetes. By the time you get diagnosed with type 1 diabetes and you have a pancreas that's not functional anymore, this has been going on for years, okay? It's been going on for years. And so that's why, are people actually testing for it properly? So if you are, do have Hashimoto's, you know that you do, well, congratulations, your doctor probably finally ran an antibody test, but this is why on a thyroid test, why we measure literally 18 different things. And yes, the most common cause of having hypothyroidism is from Hashimoto's and having an autoimmune reaction, but you got to figure out why there's that autoimmune reaction going on. So is there any intestinal hyperpermeability that's going on? What's happening with the immune system? Are there viral infections going on? Is there a lot of yeast that's going on in the GI system? And then you can go from there because there might be other things that are happening as far as thyroid conversion in the liver and the gastrointestinal system. Yes, there may be a lack of things like iron, B12. There might be a lack of selenium, might be a lack of zinc. There might be other issues, lack of iodine that are going on that may contribute to, something nutritionally as well. So this is why you have to look at it from a Swiss watch perspective, how everything is working together. Now, what kind of exercise should someone with hypothyroidism with Hashimoto's and possible adrenal fatigue be doing? I love this question. It depends on the labs. So, for example, my wife has hypothyroidism with Hashimoto's. And she works out as normal. She actually will work out according to her menstrual cycle. And there's a difference between week 1, week 2, week 3, week 4. She knows when to scale it back. She knows when she can go all out. But she also has to take care of herself and make sure her nutrition is lined up according to her food allergies. Make sure that she's not eating way too much sugar. Make sure that she's getting 8 or 9 hours of sleep every single night. Heck, I get about 5 or 6 hours of sleep at night. She gets 8 or 9. So it's just going to depend on the labs. But just remember this, guys. is that adrenal fatigue, guys, rarely ever happens. And I want you to think of it as adrenal down regulation. So with what's happening to the adrenal glands, it will cause down regulation of the thyroid. And really what they're down regulating to is things like starvation, not eating enough. It can be in a response to an inflammatory process, high amounts of mental stress. So that's why looking at this is you really have to look at what your labs are actually showing. A lot of times I'll recommend, and guys, I even own a gym, is I will say, hey, I know you go to our gym. I want you to take it easy. Put your membership on hold for 2 or 3 months until we can handle these inflammatory triggers, okay? So I'm always gonna do what's best in the best interest of the patient, but once they start to heal, then we can start adding in my favorite form of exercise, which is gonna be high intensity, short duration, functional training, with an emphasis on weightlifting and gymnastics especially. So that's a great question. I always appreciate that. Amber, thank you for the question. Amber Hernandez said, oh man, I just read this and this is going to be an interesting resources on healthy nutrition for an almost 15-year-old male athlete trying to bulk up, keeping and building muscle. Any books, podcasts, articles, anything a teenager that doesn't listen to his mother. Imagine that. It doesn't help. I am saying opposite of his coaches, and thank you. All right. So Amber, thank you for that question. I will tell you this, that there are a lot of coaches out there that are giving athletes, I would even say, quote unquote, performance trainers that are giving athletes very bad nutrition, horrible nutrition, because they say, eat whatever you want, you need to be bulking up. But in reality, what you're actually doing is you're propagating for the future of them having insulin resistance, pre-diabetes into diabetes. Guys, I'll be perfectly honest with you. If you do want to build a lot of muscle but sacrifice your health, eat a lot of carbs. Carbs releases, insulin, and insulin is very pro-growth. It's very pro-muscle building. However, I want you to think of powerlifters. They eat a lot of food, they eat a lot of carbs, they are very strong, and then they also drop dead of a heart attack at 55 years of age. So I would tell for a 15-year-old male athlete who is not yet probably growing or developing, who wants to bulk up, I would say you need to eat a lot of food, but you need to eat a lot of healthy food, which would be lots of lean protein, things that are grass-fed, organic, free-range, wild caught are going to be the best quality, obviously. And yes, if they are an athlete, they're probably going to need a little bit more carbohydrate content. So I would be doing a lot of veggies. I would be doing fruit. I also would be doing some complex starchy type things like rice. Yes, I would do that. I would even do sweet potatoes and maybe even baked potatoes depending on what their activity level. But it all comes down to, do they have a food allergy to it? Because you don't want to spike an inflammatory process and have this, poor 15-year-old crash and burn and possibly get inflamed to get injured as a result of trying to put on muscle, okay? So yes, what you eat absolutely does in fact matter. When I was 15 years of age, I ate whatever I want. I wasn't obese, I was skinny, but I hit it because I was so active. Now, I will also say this, yes, you should be eating, but also you need a stimulus in order to be able to build muscle. The best way to be able to stimulate muscle building is by doing complex weightlifting type movements. So the best muscle builders for anybody, including a 15-year-old, would be doing complex joint movements like deadlifts are great, squats are great, or any variation of the squat, like a back squat, like a front squat, like an overhead squat. You're doing a lot of bent over rows at the back. Weighted pull-ups is another great option to do. And I'm trying to think things like power cleans, power snatches, squat snatches. What those require, guys, is they require using a lot of muscles. They require the contraction of a lot of muscles. And if you want to put on weight and if you want to become more powerful, use the big movers and shakers that are contributing to most of your muscle mass, which is going to be your quads, your hamstrings, your glutes, your lower back, and then your upper back and your chest. Just stay away, guys, from doing curls, tricep push downs, stay away from doing calf raises. Those accessory muscles are not going to add much to your mass. And in fact, when you're doing things like deadlifts, for example, and you're doing like some max effort and you're doing it very heavy, you'll notice that an individual will put muscle mass everywhere and not just necessarily in the hamstrings and the glutes and then through the lower part of the back. It builds literally everything. So this is why, for me, I don't do any kind of basically bodybuilding, but I do weightlifting, lots of squats, lots of deadlifts, lots of power cleans, lots of power snatches, bent over rows. Yes, I do bench press and things like that because I want to build the biggest movers and shakers that I can contribute to muscle mass development. And then, obviously for sports, you need power, and you also, for a lot of sports, need a lot extra more weight. So hopefully that helps, quite a bit. I know for me, I've done a lot of programming for athletes. I've written about 2,000 different workouts. Maybe I should make it into a book. I don't know. But literally for about 5 years straight, I program workouts 6 days a week for our athletes at our various gyms as well. That's a great question. I actually like that question because that's kind of a passion that I have, but I don't get to talk about it all that much. Diana, thanks for the question. My blood pressure meds make me extremely tired every single day. I've heard that eating grapefruit every day will lower blood pressure. Is that true? All right. First of all, thank you for that question, but I also want to tell you this. Guys, quit running to this whole Dr. Oz approach, okay? So there's like 3 different approaches out there. There's the medicine approach that says, I have high blood pressure, take a blood pressure medication. And then a lot of times people say, I don't like that because I don't like how it makes me feel. So is there an alternative that I can still have a destructive lifestyle, but just take something natural so I don't have to change my lifestyle and then just substitute something that is a medication for something like natural, like for example, grapefruit, okay? Now, I will tell you this, we just had an individual, we've been working with him for just 4 weeks. In 4 weeks, he's lost 19 pounds and he's off of his blood pressure medication. I didn't tell him to go off of it. He had to within 10 days because we identified the inflammatory triggers. He worked on it like crazy and he was waking up and his blood pressure was actually way too low. He's like, what should I do? I'm like, you already know what you're supposed to do. So the great thing is, off of blood pressure medications in 4 weeks, blood pressure is actually normal. Now, we've been also giving him some things to help with methylation within the arteries, expand the arteries, things that will produce nitric oxide, but eventually we'll be able to take him off of that. But his blood pressure right now is running good, running perfect, and he's lost 19 pounds just in 4 weeks. And so how did we make the nutritional recommendations? From testing, looking at his insulin levels, looking at his triglycerides, looking at his A1C levels, looking at his testosterone, looking at his food allergies, gut permeability, all those different things. So why does your blood pressure medication make you extremely tired? The reason why, guys, is there's different types of mechanisms of action when it comes to lowering your blood pressure. You got calcium channel blockers, you got ACE inhibitors, and then you also have beta blockers, okay? I'm guessing, without knowing anything more about your history, is that it's making you extremely tired because you're on a beta blocker. Dr. Nate, what on earth is a beta blocker? A beta blocker is a blood pressure medication that blocks the release of adrenaline within your adrenal glands. What's interesting is that they will give beta blockers to people who suffer with anxiety as well, even depression. Because people who are constantly stressed are going to have an adrenaline dump every time they experience that stress. Now, could be actually one of the reasons why when we block that adrenaline dump, like for example, kava, California poppy, why their blood pressure actually goes down. But that is just basically based on a mental stress response. So if you're on a blood pressure medication, the biggest complaint that I get, guys, share this video because there's a lot of people on beta blockers. The biggest complaint that I get is they say, I'm so tired and I also suffer from dizziness. And the reason why is because if you're blocking adrenaline, you change positions from a seated position into a standing position. You need the adrenaline in order to increase your blood pressure in order to now push the blood up to your brain. So you're not going to have any energy if you keep blocking the adrenaline response. Now, what about grapefruit? Okay, is grapefruit, will it actually lower your blood pressure? The thing is I don't know, but I will tell you on a lot of different medications, one of the contraindications that are on the package is avoid citrus fruit and especially avoid grapefruit. Excuse me. One of the reasons why is because grapefruit will actually speed up various enzymatic pathways within your body, which will help to clear out specific medications that much quicker. So if you're taking a medication, eating a lot of grapefruit, you will remove that medication from your bloodstream as it passes through the liver that much quicker, which means that you're going to have to take more of that medication because it's just getting metabolized quicker. And this is just very specific enzyme pathways within, I can't remember which one. I don't know if it's the CYP enzyme pathways, but there's a lot of different pathways that are going on, okay? But get to the reason why you have high blood pressure. Is it mental, is it chemical, or is it due to physical stressors? That's why you have to look at all three. You have to have someone who knows how to be able to find physical stressors, chemical stressors, and obviously those mental stressors as well. That's why you should be working with a Wellness Way doctor, okay? All right, Sandy Lenartz, great question. I was recently diagnosed with osteoporosis. I don't want to go on any of these meds that they're recommending. Do you have any alternatives? Why, yes, I do, all right? Here's the thing with osteoporosis, guys, is we run to the fact that we need to be taking more calcium, but in the United States, I think we're either first or second in the world in the amount of calcium consumption in the form of dairy, in the form of cheese. But guys, you don't need dairy and you don't need cheese in order to get your calcium, because anything that's going to be grown from the ground, i.e. vegetables, is going to have high amounts of calcium. The problem that a lot of people have in regards to osteoporosis is not the consumption of calcium, it's actually the absorption of calcium. So what can interfere with the absorption of calcium? Having a very low stomach acid environment. And why are so many people, why do they have a low stomach acid environment? Because most people are living their lives in fight or flight like this. And when you're in fight or flight, because you have mental stress, because of how quickly you eat your food, because you're not winding down, you're not getting enough sleep, you're inflamed, then what happens is if you have poor stomach acid production from your stomach, it's going to cause things like calcium, among other things, not to get absorbed the way that they're supposed to. So the first thing that I always would say is check your stomach acid, because if you have low stomach acid, you probably also have a lot of food allergies as well. So getting back to this whole idea behind some of these drugs, and I haven't looked into some of the newer ones, but I remember looking into some of the older ones, and the basic mechanism of how these medications actually work, guys, this is going to absolutely stun you, is that they will block, you have two types of cells. You have osteoblasts, osteoclasts. Osteoblasts are what build bone, osteoclasts are what are actually breaking down bone. And these different cells within your bone structure are constantly working according to how you are stressing your bones. So you have bones that are breaking them down, osteoclasts. You have bones that are cells that are building them up, the osteoblasts. And in this constant remodeling phase, depending on how you're actually stressing them. So what these medications actually do is they inhibit the osteoclastic activity, which means all you're doing is building bone, but you're not able to break it down and remodel it. It's kind of like if you're going to put up a wall, and instead of building a wall that is structurally sound, you just throw a bunch of wood in there in all different directions and hope it actually holds up. Guys, just because you have a bunch of wood doesn't mean necessarily that you're going to have a structurally sound wall. You need that's why sometimes bone mass is not the most important thing. It's how structurally sound is it. So you need the activity of both of these bones, and this is why people on these medications, why they had an increase in hip fracture, because yes, they had more bone structure, but in reality, they did not produce any more quality of bone. In fact, if it was causing an increase in fracture risk, it actually was making it worse. So number one, focus on making sure, yes, you do need to be able to get calcium, but you also need to make sure that you're getting things like vitamin K, vitamin D. You also need to make sure that you're getting enough magnesium. But in addition to that, what you also need to be doing is you need to be making sure that you're stressing your bones and telling your bones, I need to remodel. And this is actually where weightlifting comes in. You need to be stressing your hips. You need to be stressing your spine. You need to be stressing your shoulder. And how do you stress it? Not by walking, by deadlifting, by back squatting, by shoulder pressing. You need to do that in order to tell the body, I need you to lay down more bone and I need you to remodel it in order to make it stronger. And this is why I'm a huge fan of weightlifting in everyone, but particularly women as they go into menopause at 50, 51, 52 years of age. I actually have my mom on a weightlifting program. She can deadlift about 150 pounds. She's stronger than most men and she's 71 years of age, but her bone mass has improved even though the doctor told her that she needed to go on an osteoporosis drug. Now, the other thing too that's really good is vibration. So a vibration platform is really good. We use them in the office for amongst other things, but one of the added benefits is that it helps to increase bone density. So the only thing is, guys, that you got to be really careful about is you got to be really careful about the manufacturer and the motor that they are using and making sure that it's vibrating at the right frequency, which is, I believe, anywhere from about 20 to 50 hertz, with 30 hertz being ideal. A lot of ones that they're selling are vibrating too much. They're actually causing tissue breakdown. Some of them are not vibrating. They're under 20 hertz. So you need to find one that's right around 30 hertz. And if you're buying one, make sure that you're contacting the manufacturer and letting them see, you see what the specs are on that specific one. So that was a great question. Cindy Swanick says, how do I find a doctor that will do these tests? Okay, pay attention to this. I can't get my doctor to take my vitamin D levels serious. It was at 5. Cindy, if your vitamin D levels are at 5, you are in a world of hurt, all right? And there's probably a lot of reasons why your vitamin D levels are at 5, and it's a lot more than just you're not taking enough vitamin D. There's probably some issues with the liver. There's probably some issues with your gallbladder. There's probably some issues with body fat, as well. So there's a lot of other issues too, other than just taking vitamin D. So let alone all the tests like iron, hormones, etc. that need to be done to know why I am suffering with many things for years and years now. Now, I will tell you this, if your doctor is not taking you seriously, you better find a new doctor. You are more than welcome to fire the doctor. As I actually will tell patients, if you don't think I'm doing a very good job, you're more than welcome to fire me as well. So you can fire your doctor. I don't care if they're a nice person. I don't care if they really care about you. Heck, I tell people, you may not even like me. But the thing is I promise you this, you may not like me. I will do my best. And it's not required that you necessarily like me. You could hate my guts, but I will do my best in order to get you better. So where do you find a doctor that will be able to do these tests? Guys, I keep saying this again, before you reach out to me, please go to www.thewellnessway.com. Please go there. There's about 60 to 70 other doctors, including guys in Europe, including Hawaii, including the continental United States. Excuse me. No, we don't have any doctors that are in Canada, although I know that we need to, unbelievably, because we've had people reach out from both coasts. It would be great. I just think probably they're so stringent as far as what they would allow us to be able to do. But go to www.thewellnessway.com, and then what you do is just go ahead and type in what your zip code is and see if you can find a doctor that is near you. If there is not a doctor that is near you, then what I would do is I would reach out to corporate Wellness Way in Green Bay, and I would say, I want to work with a doctor remotely, and a doctor can then order those tests, tell you where to go in order to get the tests, and then can go over the results and then go over with you a plan of care, either through Zoom or through or phone call. Just so you know, guys, I'm not accepting any more remote consults. My plate is full in regards to remote consults as well. So all of our consults that we're doing from here on forward, at least for the time being, is actually going to be in person here. It's just a lot easier. The communication is better, but you can reach out to the Wellness Way and see if you can find a doctor who's willing to do remote consults with you. So that's a great question. All right, if I could ask a medically related question that I struggle with, it would be this. What are your thoughts on headaches caused by weather or air pressure changes? I know there are physical reasons for headaches, dealing with stress, eating hormones. So what about headaches, and what about changes in barometric pressure? Okay, that comes from Sarah Pavey. Hi, Sarah. How you doing? I actually know Sarah personally. She's a wonderful person, referred a lot of people in, although I haven't seen her in the office yet, but maybe my answer to this question will stimulate her to be here at our inflammation talk tomorrow. All right. Here's the thing with headaches. So a lot of different reasons for headaches. I remember when I met my wife, she suffered tremendously with migraine headaches. The number one reason why she was having migraines was because of a physical trauma to her head that damaged the upper part of her neck. Literally within a day of having that trauma, suffered terrible migraine headaches. Diamond Headache Clinic couldn't figure it out. And I was a hotshot doctor and I said, I'll be able to figure it out. And lo and behold, I did. So my wife doesn't have migraine headaches anymore. She's had in the last, I think, 18 years, about 3 migraine headaches, although those have tended to be more geared towards hormonal as well, because there could be an issue with that. But the first thing you would look at is physical stressors, especially when it comes to the upper part of the neck. The position of the skull, the position of the top bone in through the neck, how well it's moving. Because guys, that is controlling the vascular supply going to your head. And it also is directly related to what are known as your suboccipital muscles. That can be a big time cause of headaches behind the head and radiate around to the front. It also can be hormonal. So when women are having some real problems with hormones and you start having some hormonal fluctuations around when you're going to start your menstrual cycle, that can also be. It doesn't mean that you have to have those things every single month. It can be due to even food allergies as well. It can be due to having issues with sinuses, which a lot of them can be related to the gastrointestinal system. But when it comes to changes in atmospheric pressure, I'm going to tell you this, is I don't think necessarily it's due to changes in atmospheric pressure as much as it's those other stressors that are going on. And guys, I want you to think of it is anytime anybody gets sick, it's really the inability of a person to be able to adapt appropriately to their environment. So when people say, oh, I have asthma because of the weather, or oh, my joints hurt because it's going to rain, I say, well, it's going to rain for me too. I'm sitting right here, but my joints don't hurt. So we're not that delicate, we're not that sensitive. There's probably other inflammatory triggers that need to be addressed, and that's why you got to look at the physical and the chemical, and heck, you even need to look at the mental and the stress levels, which you can also test as well. Sarah, thank you so much for that question. And again, guys, Sarah, I'm going to call you out. You need to be here at the Inflammation Talk coming up Tuesday. Tomorrow, 6:15, this is an in-person event. We have a lot of people register for it. We put this off for a while just so that I could catch up. And staff said, are you ready for more? I said, yes, I am. I'm feeling invigorated. I'm feeling refreshed, and I'm ready to help serve more people. So guys, go to the top of this page. You'll see this our Eventbrite link that you can get registered for it. This is your last call. When their seats are filled up, they are filled up, and we won't be opening this up again until probably another 3 to 4 weeks from now. So inflammation's the root. It's the cause of every single degenerative illness going on. Once you start tackling inflammation, then and only then will you start to heal. Then and only then can you actually start moving on to working on other things, like your hormones, yes, like rebuilding organs, yes, like your blood sugar, all of those things. You must address inflammation first. So guys, if you found this informative, if you found this life-changing, whatever you found it, please share this video with other people. The reason why I do these every single week is to make a difference in people's lives. And if I've helped change your life, please let us know as well. These things are what help keep me going. These things are what motivate me every single day. I do wake up, I stay up at night sometimes and just worried about the number of people who are sick and the number of people who just given bad information. And whatever we can do in order to spread it to as many people as possible, please join me with that. I always appreciate every single share. I always try to read almost every single comment. I apologize if I can't get to every single one of them. But also our staff has been working on it nonstop as well. So guys, I appreciate you. I always appreciate you joining us. Be well. Have a great rest of your week. I'll probably jump on Wednesday real quick for 10 or 15 minutes. And guys, I hope you have a great rest of your week. Be well, be blessed. We'll talk to you soon.